Hello everyone, it's Rayan Medical. Today we're going to talk about the anatomy of the upper respiratory system. First, let's talk about what is the respiratory system. It is composed of two things, the upper part and the lower part. The upper respiratory system is what we're going to focus on in this video, which is composed of the nose, nasal cavity, paranasal sinus, pharynx, and larynx. Here is a picture shows upper respiratory and the lower respiratory systems. For the upper one, it has the nasal cavity, pharynx, and larynx, as we said, and the nose and other stuff in the upper respiratory system. And here is the lower one, which is composed of the trachea, primary bronchi, and lungs. So let's start off with the nose. The nose consists of external nose and the nasal cavity. The external nose has two orifices or the openings in the front of the nose that every human have. They are called nostrils. They are separated from each other by the nasal septum. The framework of the external nose is made up by in the above part there are bones, the nasal, maxillary, and frontal bones, and the below there is the cartilages. So here's the framework of the nose. For in the above there is the frontal bone, nasal bone, and frontal parts of maxilla, which is paired. And on the lower part there is the cartilages, upper lateral nasal cartilage, septal cartilage, and lower lateral nasal cartilage. For the nasal cavity, the cavity of the nose is divided into right and left halves by a nasal septum, as we said before. Each cavity open into face by nostril, which are the openings, and posteriorly onto the nasopharynx by posterior nasal aperture or another opening, which is called choana. The boundaries of the nasal cavity has a roof, floor, medial wall, and lateral wall. So here's the frontal part of the nose. Here are the openings or the orifices. And at the back there is the choana, which are another openings that leads to the nasopharynx. And there is the boundaries, which are the roof, lateral wall, medial wall, and the floor. Let's talk about the boundaries, each boundary. For the roof, there is the nasal bone, cribriform plate of ethmoid, body of sphenoid, and for the floor, it is formed by hard palate. The medial wall has the septal cartilage, perpendicular plate of ethmoid, and the vomer. So in this picture, on the roof of the nose, you can see the nasal bone right here, the cribriform plate of ethmoid, which is somewhere right here, and the body of sphenoid, which is somewhere right here. For the floor, as we can see, it has a hard palate, and the medial wall is on the middle of the nose. It has the septal cartilage, which is this one right here, the perpendicular plate of ethmoid, this one right here, and the vomer bone, which is this one right here. And for the lateral wall, there is a vestibule, which is a dilatation above nostril, the atrium, which is a depression above and behind the nostril. It has three nasal conchae, three elevations, superior conchae, middle conchae, and inferior conchae. So this is the superior conchae, the middle conchae, and the inferior conchae. And it has also a meatus, which are the spaces under the conchae. This is the superior meatus, middle meatus, and inferior meatus, which we are going to talk about in the next slide. So then The meatises, as we said, is a space below each concha. The superior meatus receives posterior ethmoid area sinuses. The middle meatus shows two things: the bulla ethmoidalis, which is an elevation which opens middle ethmoid air cells, and the hiatus semilunaris, which is a groove below the bulla, which receives the openings of anterior ethmoid, frontal, and maxillary air sinuses. And there is the inferior meatus, which receives the opening of nasolacriminal ducts, which is the tear duct. It's also called the tear duct, which are responsible for the tear secretion. There is also the sphenoethmoidal recess. It is a fossa between the superior concha and the roof of the nose, which receives opening of the sphenoidal air sinuses. Let's talk about the sinuses. What are the sinuses? They are air-filled spaces in the skull bones surrounding the nose. The functions of the paranasal sinuses is to decrease the weight of the skull and increase the resonance of voice. The paranasal sinuses are absent at birth, except the maxillary sinus. They show marked growth at time of eruption of permanent teeth. So there is the frontal air sinus, the ethmoidal air sinus, sphenoidal air sinus, and the maxillary air sinus. Let's talk about the pharynx. It's a funnel-shaped musculomembranous wall which is deficient anteriorly. It extends from the base of the skull to the lower body of the sixth cervical vertebra. It has muscles, superior, middle, and inferior constrictor muscles, which run in circular direction, and the stylopharyngeus. There's also the stylopharyngeus and salpingopharyngeus muscles, which run in longitudinal direction. So here are the muscles: the superior constrictor, middle constrictor, and the inferior constrictor. There's also the salpingopharyngeus right here, and the stylopharyngeus right here. So they're all just muscles of the pharynx. Let's talk about the inferior of the pharynx. So the pharynx is divided into three parts: nasal pharynx or nasopharynx, oral pharynx or oropharynx, laryngeal pharynx or laryngopharynx. So here is the nasopharynx, oropharynx, and laryngopharynx. Let's first talk about the nasal. It lies above the soft palate. This also is only the location of it, which we can see in the picture. It shows the following features: nasopharyngeal tonsil, opening with the auditory tube, tubal elevation, pharyngeal recess, and salpingopharyngeal fold. So in this picture, which is a magnified picture of the nasopharynx, it shows the nasopharyngeal tonsil, which is this one. It shows the opening of the auditory tube. It shows the tubal elevation, and it shows the pharyngeal recess, and finally the salpingopharyngeal fold. Let's talk about the oral pharynx. It lies behind the oral cavity, extends from soft palatal to the epiglottis below, communicates anterior with the oral cavity through oropharyngeal isthmus. The floor is formed by the posterior third of the tongue, which contains lingual tonsil and the interval between the tongue and epiglottis. The lateral wall of oropharynx presents the palatine tonsil, and together the palatine tonsil with the lingual and nasopharyngeal tonsil form a ring of lymphoid tissue called Waldeyer ring. For the laryngeal pharynx, it lies behind the opening into the larynx, extends from the upper border of epiglottis above to the lower border of the cricoid cartilage. Below, the periform fossa is a depression in the mucous membrane on each side of the laryngeal inlet. For the larynx is the organ of voice and acts as air passage. It lies in the median region of the neck, extending from the middle of third cervical vertebra to the lower border of the sixth cervical vertebra. It is formed of a number of cartilages connected together by ligaments, membranes, and lined by mucous membrane and moved by muscles. For the cartilages, there is epiglottis, thyroid cartilage, arytenoid cartilage, cricoid cartilage, and the corniculate cartilage. There is also the cuneiform cartilage, which lies right about there, and on the other side as well. There is also membranes and ligaments, the lateral thyroid ligament, the thyroid membrane, median thyroid ligament, and the median cricothyroid ligament, the cricotracheal membrane, the hypoepiglottic ligament, quadrangular membrane, vestibular ligament, vocal ligament, conus elasticus, which is also a ligament, medial cricothyroid ligament. There is also a cavity for the larynx. The laryngeal orifice is bounded by epiglottis in front, epiglottis fold on each side, intra-arytenoid fold below and behind, and it is divided into three compartments by two pairs of folds, the upper fold called vestibular fold, the lower fold called vocal fold, and the compartments which are the vestibule above vestibular fold, the ventricle between the vestibular fold above and vocal folds below, and the infraglottic compartment which lies below the vocal folds. Here's the epiglottic fold, and here is the epiglottis. There are other stuff you can pause and review. There are also muscles. The muscles is divided into two groups, extrinsic and intrinsic, and the extrinsic is also divided into two groups, elevators of the larynx and depressors of the larynx. And for the intrinsic muscles, divided into two groups as well, the muscle controlling the laryngeal inlet and the muscles controlling the movement of the vocal cords. And these muscles are muscle increasing the length and tension of the vocal cords called cricothyroid, muscle decreasing the length and tension of the vocal cords called thyroarytenoid, the abductors of the vocal cords, which are the lateral cricoarytenoid and the transverse arytenoid, the abductor of the vocal cords, which are the posterior cricoarytenoid. There are also blood and nerve supply. For the nerve supply, there is sensory and motor. The sensory is above the vocal cords, internal laryngeal nerve, branch of the superior laryngeal branch of the vagus nerve, and below the vocal cords there is the recurrent laryngeal nerve, branch of the vagus nerve. And motor, all intrinsic muscles except cricothyroid supplied by the recurrent laryngeal nerve. The cricothyroid muscle is supplied by the external laryngeal nerve, which is a branch of the superior laryngeal branch of vagus nerve. So with that being said, if the external laryngeal nerve is damaged, you will have the hoarseness voice, you can't raise your voice. And if the recurrent laryngeal nerve is damaged, the speech will go away, you can't talk. And there is also the blood supply, arteries, upper half superior laryngeal artery, which is a branch of superior thyroid artery, and lower half, which is the inferior laryngeal artery, which is a branch of the inferior thyroid artery. There are also veins, which accompany the corresponding arteries. And that's it for today. So we talked about the anatomy of the upper respiratory system. And please like this video, share it everywhere, and I hope it was informative. See you later. Bye.